Thank you very much, Madam Chair, Ranking Member Deutsch, members of the subcommittee, and also I think we're privileged to have other chairs of the other subcommittees here, which shows the seriousness, I think, with which you are taking this crisis, for which we are very, very grateful. We're very grateful you're calling attention to this enormous crisis. I want to thank you for holding this hearing and also express our appreciation for the resources authorized and appropriated by the Congress. These funds are saving lives and easing the suffering of millions of people. Please accept my longer testimony for the record. What I'd like to do is speak very quickly and briefly about the main points. This crisis is vastly different than a year ago, and alarmingly so. Last September, we were concerned about a refugee population of about 230,000. And today it stands at 2 million, so nearly 10 times that earlier number. Combined with 4 or 5 million people now displaced inside Syria, as you've said, nearly 1/3 of Syria's population has left their homes. This is now the largest displacement crisis in the world. To put that in perspective, imagine the entire population of Washington, D.C. being forced from their homes and then double that number. More people have fled the country than either of the crises in Rwanda or Bosnia. 2/3 of the refugees are women and children. The numbers above are shocking by themselves, but behind them are millions of individual tragedies. I have met families blown apart by the violence, fathers killed or missing, the elderly suffering from lack of medical care, children traumatized by what they've witnessed. We have seen a widow struggling to find food for her 5 children, and toddlers horribly disfigured by bombings. Families live in shanty towns with open sewage, prey to disease and exploitation. The point of these images is to stress that amid the discussion of the Syrian regime's atrocities and the political debates about the best way forward, our efforts as leaders among nations should continue and even intensify to assist the innocent Syrian civilians. The United States is not taking on this challenge alone. Turkey, Jordan, Lebanon, and Iraq, and Egypt have allowed the vast majority of the 2 million refugees to cross into their territory. Other donors have provided important assistance, and in the midst of this tragedy, U.S. assistance is saving lives and making a real difference. The United States has provided $1 billion in aid since the crisis began. Our aid, channeled through United Nations organizations and reputable international non-governmental organizations, helps get the widow with 5 children linked to one of our partner non-governmental organizations that provides food and medical assistance. UNICEF efforts help ensure the horribly wounded 3-year-old I mentioned got medical attention. The toys UNICEF brought made him smile for the first time in months. Beyond food, medical care, and other traditional assistance, along with USAID, we are using innovative methods to address the urban population, providing food vouchers and debit cards for use in local markets and cash assistance to help refugees pay rent. We support programs to keep children protected and to prevent and respond to sexual and gender-based violence. Overall, we are helping millions of people. But this assistance is spread thin. Many remain very difficult to reach, and we have many concerns. We need to help not only refugees in camps, but also those living on their own or with relatives in villages or cities where hundreds of thousands of destitute families are trying to survive. Increased assistance by other donors is critical to get help to more people. Development funding from international leaders like the World Bank is needed in addition to humanitarian assistance to help the countries that neighbor Syria. Lebanon, Jordan, and northern Iraq in particular need support for their economies, infrastructure, and public services. I remain concerned about safety in refugee camps, about the spread of disease in camps and overcrowded neighborhoods, and the many Syrian children who are not in school, and we support programs to tackle each of these challenges. Michael Clausen of the Save the Children met with refugees in Amman on Monday. He sent me an email and told me that one 10-year-old girl he met, whose father, a taxi driver, had been missing in Syria for a year and now lives in East Amman with her family, said she wants to grow up and be a doctor because if something happens to you or someone dear to you, you can help them. I was so touched by that. This girl who's lost so much wants to help other people. That's the future orientation we all need to nurture in these children. Our greatest concern, of course, is for those still inside Syria who remain vulnerable to attack and whom aid agencies often cannot reach. What good is getting aid inside Syria if the aid recipient is caught in the crossfire, bombed, or gassed by his or her own government? It is well known that war is not ended by more and better aid deliveries. Peace must be negotiated, and we salute our colleagues, American diplomats and their counterparts from other countries striving to do so. Until then, we will urgently need to continue our work and need your support and the support of American people in our efforts. I look forward to your questions.
Thank you very much. Ms. Lindborg.
Chairman Ross-Leighton, Ranking Member Deutsch, members of the subcommittee, and guests, thank you very much for holding this hearing today and allowing us to focus attention on the very serious humanitarian crisis unfolding in Syria in the region. And a special thanks for your continued support for the humanitarian programs here and really around the world. This represents the best of American values, and it is making the difference in the lives of millions every day. And I welcome the opportunity to update you on the humanitarian crisis, our response, and the continued challenges, because the one constant in the Syrian crisis is the continued toll on the Syrian people. As a number of you all have noted, children are out of school for the last 2 years. Women are enduring rape and violence. The 1/3 of Syrians who are forced out of their homes, and more Syrians who are now forcibly displaced than anywhere else in the world. The pace of escalation, as noted, is truly staggering, and the numbers are hard to truly comprehend. Just in the past year, death rates have gone from 26,000 to more than 100,000. There is an estimated 5,000 people killed every month, many of them women and children. The number who need our help inside Syria a year ago was 2.6 million. Now it's more than 6.8 million. Imagine the equivalent of all of Vermont, New Hampshire, Maine, and Connecticut, all of those populations combined needing humanitarian assistance. So as the crisis has escalated, we have also accelerated our humanitarian response. Since last year, we have doubled the number of partners that we have working inside Syria. We've shored up systems and supply lines to increase our ability to reach people throughout the country, even in conflict that continues to move around. Our assistance is more than $1 billion region-wide, and we're reaching 3.5 million people inside Syria in all 14 governments. We're working through all possible channels to provide life-saving assistance, and we're focusing on 3 key areas that provide a lifeline for people who are under siege inside Syria. And the first is medical care, and we started 2 years ago really focusing on trauma care. As the conflicts persisted, we've had to broaden that out to meet medical needs of women and children who no longer have access to health care. And we now support about 260 medical facilities across Syria. When warm weather hit last year, we were worried about communicable diseases spiking, so we established an early warning system that enables us to have early disease protection and a fast response. As noted, women and children are especially at risk. Gender-based violence is rampant inside Syria, so this is a special focus of our programming. Secondly, food assistance. We are helping to feed 3 million people inside Syria and more than 1 million refugees every month through the World Food Program and our NGO partners. We're meeting those needs using the flexible mechanisms through our Emergency Food Security Program. This lets us do local regional purchase and food vouchers. And recently there was just a flood of refugees that went into Iraq, 44,000 in 1 week. We were able to airlift 15 metric tons of USAID nutritional bars to get there fast and meet their needs. I was recently in Beirut and Amman, and in both cities I met with groups of women, and they have these stories of having to grab whatever they could as the bombs are falling. They're grabbing shoes, clothes, their children. They're watching bombs destroy their homes and their villages. So they often have nothing, and they're rotating as they flee conflict, often 2 to 3 times being displaced. So we also focus on vital relief supplies, as well as clean water and sanitation as they are displaced around the country. 3 enormous challenges. The first is access. We are not able to reach everywhere we need to inside Syria. We've seen some breakthroughs with cross-line assistance, but a recent UN cross-line trip to Aleppo supposed to take 3 hours, it took 3 days because they had to navigate 50 checkpoints along the way. At every chance, we continue to push for greater humanitarian access, including cross-border. The second is security. Aid workers continue to be targeted. One of our partners, as Mr. Smith noted, has lost 37 medical staff, 21 injured, 13 arrested. Let me underscore that we would be nowhere without the courage of the humanitarian aid workers. Thank you for honoring them. They risk their lives every single day. And the most profound security environment means that we have to prioritize the safety of our partners and the communities that they serve. The third challenge is resources. As noted, this is an enormous appeal. It's a protracted crisis that is now a regional crisis and an international crisis that requires the entire international community to step up to the plate. We're working to develop a comprehensive platform that enables us to bring our development assistance in line with our relief assistance, particularly in the communities in Jordan and Lebanon, where the refugee burden is stressing key infrastructure. Our contingency funds, like the USAID Complex Crisis Fund, is being deployed to help communities meet these needs. Humanitarian assistance will not end the bloodshed, but it is saving lives. It's helping alleviate suffering. It is a critical lifeline to people in need, and we will remain very committed to providing that kind of assistance. Thank you so much for your support, and I look forward to your questions.
Thank you to both of you for the great work that you do and all of the folks that you help.